Hello, and welcome to MFR Self-care Techniques with Anna Bear. Before we begin, please remember this video is for educational purposes only. It's not medical advice. Myofascial release is gentle and usually safe, but always check with your healthcare provider before starting any new technique, especially if you have a medical condition or injury. All right, today we are going to do ear pulls. So, if you're going to join along with me, go ahead and get comfortable because we're going to hold this for at least 5 minutes. This video is about 7 minutes long. So as you can see, my position is a little less comfortable. My elbows are kind of out. You can also, if you're at a table, sit down at the table, plant your elbows on the table, and as you grab your ears, let your head kind of rest, supported by how you're holding your ears. So yeah, you can see here how I'm holding my ear like that. That's the goal, that kind of position. And then you pull out away from your head and then back towards the back of your head. And as you do this, you want to do really gentle pressure, especially right at first. MFR doesn't force things. We find the barrier, that first spot of resistance where your ear doesn't want to be pulled any farther. That's the barrier. We find the barrier and then we wait for it to soften. And as fascial restrictions release, it feels like butter melting or taffy getting soft. And so you can, if you think of those things, you might notice those releases. And as the releases happen, you can add a little bit more pressure, take out the slack, but never force. MFR never forces. And that's one reason why it is so safe, is because we don't force anything. And then the reason why we do these holds for so long, it can be 5 minutes or even longer. And at first it can feel like nothing's happening. Why am I doing this? And that's fine. The fascia needs time to respond. A lot of people come into MFR being used to quick stretches or fast adjustments, but actually fascia doesn't work that way. It needs time to respond. So a lot of times it'll take 90 to 120 seconds just to get those first releases, those first restrictions letting go. Then from around 3 to 5 minutes, you start to feel deeper shifts of things changing. You can see I'm kind of moving my head around, and so we're at the 3-minute mark in the video, and I am feeling, my eyes kind of roll back a little bit. I'm starting to feel the fascial MFR responses in my body. Now my kid said something funny, so I'm laughing. So even if it's feeling like nothing's happening, trust the process. Things are happening, just slowly. So around 5 minutes, I'm going to use some fancy science terms. The structure of the ground substance in your fascia starts to change. It's called phase transition, where the thick, gluey tissue becomes more fluid and watery. And it creates a tiny electrical current. And this phenomenon is called piezoelectricity, which helps give your body signals to heal these biological processes. So you can see I'm frowning here. I think some emotions are coming up for me, and that can happen with MFR. And I'm also talking to my cameraman, who is my daughter. But Yeah, she says camera woman, camera person. You also might notice I have adjusted my hands a couple of times, and so if you are sitting with your elbows on the table, that helps hold the position. And another thing, as you're trying this at home, it is important that you keep a continual steady pressure. You don't want to you can go from very light pressure to slightly more pressure throughout the hold as releases continue, but you don't want to go from any level of pressure to less pressure. That means you have to start over with your time if you let go of your pressure. So we're at about the 6-minute mark here. And so if you've been holding this the whole time, you might start to notice changes in your body, and that's great. One of the benefits, maybe I should have started with this, but some of the benefits of doing the ear pull is it can help with pain in your ears. If you get frequent ear infections, it can help with that. If you use Q-tips, you're not supposed to use them in your ears. I always hear, and yet I always feel like using them in my ears because my ears get itchy. But this, I've noticed when I've done daily ear pulls, that itchy feeling goes away, and my ears just feel healthier. It's also pulling on the fascia of that bone back there, and that is great for giving more movement to the bones in your skull. If you found this video helpful, if you tried an ear pull on your own, let me know in the comments what effects you found, and like and follow me for more info, more videos and self-care techniques. Thanks.